I'm Sally Rafie, a pharmacist and founder of the Birth Control Pharmacist Project. Despite the many methods of birth control that are approved for use here in the United States, many people continue to encounter barriers in trying to access the method they want. Pharmacists are one of the most accessible healthcare providers, with nearly every American living within just a few miles of a community pharmacy. And we're the medication experts. We have the knowledge and skills to help people with their birth control. The decision on whether to allow pharmacists to prescribe birth control rests with our state lawmakers. And while they continue to consider these issues, people are facing barriers to accessing the methods that they need. Pharmacist prescribing of contraception can eliminate barriers to access for some patients. Access is particularly challenging for women with low income or those who live in rural areas. Pharmacies often have hours into the weekends and evenings when other providers may not be available. When the pharmacist is able to prescribe contraception, it allows our patients to make a single visit for both the consultation and supplies, which is convenient for patients and also reduces healthcare resources. Allowing women to get their contraception directly from a pharmacist is particularly important during this pandemic when people are looking for safe and convenient access to healthcare. Currently, 18 states allow pharmacists to prescribe contraception, and many others are trying to pass similar policies. There are over 3,000 pharmacies participating across the states where policies have already been implemented. Thank you for considering a policy that would empower the pharmacists in your state to serve their communities with access to birth control. As you design your policy, we'd like to learn from states where this has already been implemented. We want these policies to be as evidence-based as possible. Please consider that there should be payment from health plans for this pharmacist service to reduce patient out-of-pocket costs. We also want to be sure that we don't include any age restrictions, again, to make sure that it's evidence-based and can serve as many people as possible. In order to allow people to access contraception safely and effectively, states should consider allowing pharmacists to prescribe this directly to patients. While this is a great policy option, it is just one of many policies that would support access to birth control. The pharmacists in your state are ready and standing by to serve their communities.